You can't be a little pregnant. You can't have a little gluten.
And this is for everyone, or?
No human can digest wheat completely into amino acids. No human can.
I never thought about this.
That's what they're teaching at Harvard Medical School right now.
Gluten causes inflammation.
Every person has an immune response to wheat.
Is there an amount that is okay, or would you say
63% of the time, people get better on a gluten-free diet.
you can have, I don't know, I'm just saying, one pizza a month or whatever.
They feel fine when they eat wheat.
Leave away the gluten for whatever weeks, right?
My God, that's everything I eat.
Get sick and we'll help you.
People got better on a gluten-free diet.
The truth is in the data.
In 2008, I did 26 8-hour days teaching about the dangers of gluten.
We don't have to cure people. We have to, prevent them from getting sick.
That's exactly what we do.
Usually they die.
What?
But if you have cancer, it's better to know.
No, that's not supposed to happen.
It's better to know.
Every single time.
What's like one common sense thing you would tell them, hey, if you do one thing, do that?
Increase hydration levels.
The following is a conversation with Dr. Tom O'Brien. He's really an interesting guy. He's a doctor, first and foremost. He's focusing on gluten and the brain. These are kind of his two main books. You can Google them. You'll find them, bestsellers and stuff like that. And really diving deep into what actually makes people sick, how to stay healthy, how to test to stay healthy, because this is what it's all about, Test, evaluate, improve. And this is the cycle of life, in my humble opinion, when it comes to proactive healthcare, not reactive healthcare, because quite frankly, this is the fix for our healthcare system. Understanding the diseases before you have them and not even getting there that you have them, instead of, getting sick and then, I don't know, doing chemotherapy for 10 years and all the stuff and feeling horrible, So this is what I'm really about. I'm about proactive healthcare. I'm about understanding what makes my body better. And this is what we're gonna talk about today. Really, how to hack your health, how to hack your brain as well, in the best possible way, of course. And just how to be the healthiest possible person. And it really might not be as obvious as you think. Of course, there's the basics, but there's really a lot of interesting research around gluten, which he's going to talk about in this episode. So without further ado, Dr. Tom O'Brien. Well, Tom, thank you so much for having us here in beautiful Piedmont.
Oh, yes. Thank you. It's a pleasure.
We just had a lovely lunch here, eating, I hate to say it, but I had some wonderful pasta. Miron, the producer, as well.
Yes.
So this is actually a beautiful segue to the first question, because why do you think gluten might be not so beneficial for the everyday person? Can you explain it like in simple terms? Because for me, truly, I love it. I love it. And when I eat it, I don't particularly feel bad. And I think most people don't. So it would be interesting to understand what's really the link there, how it works, and why it might not be so beneficial also for, the everyday person.
There are three concepts to understand. First, when you say, I don't feel bad when I eat gluten, in Italy, there are 36 centers designated by the government as gluten-related disorder centers. And if you receive a diagnosis from one of those centers, there's 20-some gastroenterology centers, a couple pediatric, a couple psychiatric. If you receive a diagnosis from them, your gluten-free food's a tax deduction. So doctors all over Italy, if they suspect their patient may have a gluten-related problem, they'll refer them to one of these centers for the diagnosis, right? And from those centers, they've looked at thousands of patients who were referred to them. So these are people who are sick. And the doctor suspected that maybe gluten is a problem, so they sent them to a gluten-related disorder center. 9% of the people who test positive for a sensitivity to wheat have gut symptoms. 91% do not. They've got brain symptoms, or joint symptoms, or skin symptoms, or emotional symptoms. They don't have gut symptoms, so they feel fine when they eat wheat. But they still have the inflammation going on, the activated immune system that's setting them up for their rheumatoid arthritis or their multiple sclerosis or their Hashimoto's thyroid disease. And we'll get into what determines what disease somebody gets. But that's the first concept, is that you can't say, I feel fine when I eat this food and conclude that the food is okay for you. It's false thinking.
So you might not feel it, but
You don't feel it, but your immune system, if, let's say, for example, you have a genetic sensitivity to your liver not detoxing very well, right? And if you have that sensitivity, when you eat something that activates your immune system to produce inflammation, that inflammation will manifest where your genetic sensitivity is. And not in a day or in a week, but over time, because you get weaker and weaker and weaker. And so it manifests wherever. There's two things that determine. See, if you pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end. It's your heart, your brain, your liver, your kidneys, your reproductive system. It just depends on where your genetic vulnerability is. Well, it depends on where your vulnerability is, where the weak link is. And that's determined by two things: your genetics, and this is a geek word, the antecedents, which means how you live your life. You eat tuna fish 2-3 times a week, you likely have mercury toxicity because almost all the tuna is high in mercury. That's an antecedent. So how you live your life and your genetics determine where the weak link is. That when you pull on the chain too hard, that's where it's going to break. Okay? That just makes sense, doesn't it?
I agree.
Okay. So what's the pull on the chain? The pull on the chain is always the same. Always. The pull on the chain is inflammation. It's always inflammation.
And how do you measure this? Like, this is a test
Oh,
you can do?
yeah, there's a whole answer to that. Yeah, there's beautiful tests are out now, and let's talk about that, but I want to stay here if I can.
Absolutely.
So when you pull at the chain, and if you have a sensitivity to wheat, only 9% of the people have gut symptoms. Their weak link is somewhere else, and they get thyroid symptoms. They get elevated antibodies to their thyroid, or they get depression because there's not enough blood flow going into the brain. 73% of celiac patients, which is a wheat-related disorder, not the only one by any means, but 73% of celiac patients have a lack of blood flow in at least 1/3 of their brain. It's called hypoperfusion. That's the geek word for it.
Can we quickly define that celiac and non-celiac? Because I think
Yeah, we'll get there.
people
Yeah.
know that. Because the question was kind of targeted for non-celiac people.
Right,
So
and I'm
for
answering.
everyday Joe, basically.
And I'm answering for non-celiacs, but just to give you a sense here. So if you cross your legs for 3 hours, then stand up and run. You can't. There's not enough blood in your leg, right? When you have a lack of blood flow in your brain, it doesn't work the way it's supposed to. So depending on what area of the brain has this hypoperfusion will determine, do you get depression or anxiety?
What does that word mean?
Hypoperfusion, the lack of blood flow
Got it.
into the brain.
Got it.
Depression, anxiety, schizophrenia, bipolar disorder, seizures. In the Journal of Gastroenterology, they published a paper that said children with drug-resistant epilepsy, which means seizures. These children are getting seizures, and they've tried at least 3 drugs, and they're still getting seizures. That qualifies as drug-resistant. 50% of those children go into complete remission on a gluten-free diet. 50%. And it's like, wait, what? What? But why don't our neurologists know this? Because it was published in a gastroenterology journal. And neurologists don't read gastroenterology journals, they read neurology journals, right? So the weak link will manifest wherever your genetics and your antecedents determine. But the pull on the chain is inflammation. Okay, that's the first component of the answer about why is gluten a problem.
So basically, gluten causes inflammation. Inflammation kind of attacks your weakest link in the body, whatever that might be.
Inflammation exaggerates or will manifest your weakest link. Eventually, it might take 10 years. It might take 15 years. Well, we know now if you do the proper blood test, it's called predictive autoimmunity. We can tell you what autoimmune disease you're vulnerable to developing and how many years before it's going to show up. Those tests are available now. I mean, the science is really cool on this stuff. It's really great. So, next anatomy component of the answer. You have the same body as your ancestors thousands and thousands of years ago. And same kidneys, same immune function, same brains. We use our brains more and we've developed creature comfort and all of that, right? But before agriculture, 10,000 years ago, our ancestors were nomads. They followed the herds. And their primary focus on a daily basis was finding food, then shelter, then safety, then reproduction, but food was number one, right? So they'd be walking around, they'd see something and they'd grab it. First, they sniff it. Perhaps later we'll talk about the importance of the sense of smell. They sniff it. Then they nibble at it. Then they eat it. If they couldn't tell that there was bad bugs in the food, if they couldn't identify it and they ate it, you have sentries standing guard in the first part of your small intestine. I like to think of the soldiers at Buckingham Palace with those big hats. They're just standing there as stiff as can be. They're dormant. They're not doing anything, right? But don't mess with those guys. Do not. Those sentries in your gut standing guard are called toll-like receptors. And their job, toll-like receptor 4, its job is to watch everything coming out of the stomach. Because when it comes into the intestines, now it can get in your body. Mrs. Patient, your digestive tract is a tube. It goes from the mouth to the other end. One big long tube, 20, 25 feet long. If you think of a donut and you could stretch a donut, that's your digestive tract, right? So when you swallow food, it's not in your body, it's in the tube. And it's got to go through the walls of the tube to get into the bloodstream. Now it's on the highway of life, right? So food can start coming into the bloodstream in the small intestine. So what happens, right there at the beginning of the small intestine, you have these toll-like receptors that are watching all the food that's coming from the stomach into the intestines. Its job is to identify if there's a dangerous bug. That's its sole job. And those ancestors that didn't have good toll-like receptor function, couldn't identify what the problem was, they died. They died. They did not reproduce. We are all the offspring of the generations of ancestors who had really good toll-like receptor function. So we survived because if that sentry identifies a bug in the food that you're eating, two things happen within 5 minutes. And when you see the videos, this is really cool to see it. I'm a geek and I just love watching that stuff. Two things happen. First, the toll-like receptor sends a message, start making some zonulin, and that's a protein that causes leaky gut. Zonulin opens up the space between the cells in the walls of the tube so that when you open the space, water leaks into the tube, right? Why? Because it's going to wash out the bug with the poop. It's a life-saving mechanism. Leaky gut is not bad for you. Excessive leaky gut is bad for you.
Can you define that quickly, leaky gut? Because me personally, I don't understand that word.
Yeah. Okay. This will take a couple of minutes.
That's fine. And then we can jump back. Exactly.
Then we'll come back in.
But everything makes sense.
Your intestines are a tube, 20, 25 feet long. The inside of the tube is lined with cheesecloth. Do you know what cheesecloth is? Your grandmother used to pour the gravy in the cheesecloth and only the liquid comes through and all the clumps stay there. So the inside of the tube is lined with cheesecloth. When you take a bite of a hamburger, And most people chew 3-4 times and they gulp it down. You should chew 15 times and really masticate it, but we don't, most of us. That clump of meat cannot get into your bloodstream. If it did, it would be poison. Think of that clump of meat like a pearl necklace, and the acid in your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls. And your digestive enzymes act as scissors to cut that pearl necklace smaller and smaller, snip, 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 on the ends and in the middle, and on the new ends and the new ends, and in the middle, new ends and new ends in the middle, until you break it down to each pearl of the pearl necklace. That pearl of the pearl necklace goes right through the walls of the intestine, goes right through the cheesecloth into the bloodstream. That's absorption. And any bigger molecules have to be broken down, go further down the digestive tract before they can get into the bloodstream, right? But when you have tears in the cheesecloth, now bigger clumps of that food called macromolecules can get through into the bloodstream before they've been broken down small enough. It's not a bad food, but it's a macromolecule. And your immune system that's monitoring everything says, what is that? I better fight that. Now you make antibodies to that food. And these are the people that do 90 food blood panels, and it comes back they're sensitive to 15 or 20 or 25 foods. And they say, oh my God, that's everything I eat. Well, of course it is. You've got a leaky gut. And these macromolecules are getting in before they've been digested small enough. Heal the gut, wait 6 months, and go back and test again. Now you're allergic to 2 foods, maybe 3. That's the leaky gut.
So basically, to summarize, kind of in my own words, you have too big of chunks that you swallow, and that kind of, it shouldn't really go into your bloodstream because it's not made for it, but it still does because, well, you didn't care enough to pre-process it, and that just causes issues. Right?
Well, it won't go into the bloodstream if you have a healthy gut. It gets digested smaller and smaller and smaller and smaller.
Yeah.
But when you have tears in the cheesecloth, now these bigger molecules that are in the process of being digested, they get in too soon.
And these tears, they're basically the leaky gut, right?
That's correct.
Got it. Okay.
The tears are the leaky gut.
Yeah.
And that is the gateway in the development of almost every autoimmune disease. That's what they're teaching at Harvard Medical School right now, is that it's the leaky gut. As an example, Professor Alessio Fasano, professor of medicine, Harvard Medical School, professor of nutrition, Harvard School of Public Health, the chief of pediatric gastroenterology at Mass General at Harvard, the director of the Celiac Research Center at Harvard, the director of mucosal immunology, that's the lining of the gut, the lining of the brain, the lining of the lungs at Harvard. 5 titles this guy has. Any one title is a lifelong goal for someone at the top of their game. He's got 5. We think he's going to win the Nobel Prize because it was him and his team in 1997 that identified this mechanism of where leaky gut comes from. And he's got over 350 publications now to his name, right? So you'll see a very important medical article in a reputable journal, and there'll be 8 authors. And the last one, Alessio Fasano, the boss, right? The stamp of approval, right? And he's always so careful about what he says, always. This article he wrote himself, which gives you a sense of how important he thinks it is. Now, this is one of the greats in the field, the big thinkers who are teaching our young doctors how to think the big picture to help people be healthier, not just how to deal with the disease. He's got a really good big picture. This article he wrote himself, and it's game-changing when you understand the article. The title of the article, All Disease Begins in the Leaky Gut. All disease, the role of the protein zonulin in the development of chronic inflammatory diseases. That gives you a sense of the importance of this topic. Now, Hippocrates said the same thing. All disease begins in the gut thousands of years ago. And we're coming back to it today, but now we have the science to understand the mechanisms of how it occurs. And when you have the leaky gut, the tears in the cheesecloth, now you create the inflammation in the bloodstream that pulls at the chain that manifests at wherever your genetic and antecedent weak link is. Here comes your Hashimoto's thyroid disease. Here comes your psoriasis. Here comes your depression. Just Google schizophrenia and gluten. Here come the studies that sometimes it makes a world of difference, because for that person, the pull on the chain that was manifesting as schizophrenia was from gluten, primarily from gluten. Not everyone, but many people. So that's the way you think about it. All disease begins in the leaky gut, which means it almost doesn't matter what your health complaint is. A component of what you have to do for everything except trauma, trauma is trauma, but for almost everything else, you have to include evaluating and treating the gut. Doesn't matter if it's hearing, it doesn't matter what it is. If you want to reduce the inflammation, you also have to look at the gut. Now, here's one more statistic for all of this. The Center for Disease Control tells us that 14 of the 15 top causes of death are chronic inflammatory diseases. It's always inflammation, except for unintentional injuries and accident. Everything else, whether it's kidneys or heart or brain or liver or skin, cancer, it's always inflammation, pulling on the chain that breaks at wherever your genetic and antecedent weak link is. Now, this sounds almost simplistic, but when you think this way, for well over 90% of the complaints that people come to a doctor with, they turn them around. They completely reverse them when they ask the question, where is my inflammation coming from that's pulling on the chain? Is it gluten? Only 9% get gut symptoms with gluten. Is it gluten? Is it dairy? Is it mold, living in a moldy house? Is it toxic air? Is it emotional instability? Is it structural? When you look to see where is the inflammation coming from, you now understand what it's going to take to turn around the direction of your health. Okay, so that's the gut, that's the leaky gut, and all of that. Now back to your question about gluten. So, toll-like receptor that's in the first part of the intestines is watching all the food that comes out of the stomach. Is there any bacteria? Is there anything that's dangerous for us? And if it sees that, it does two things within 5 minutes. First, it increases zonulin, that's the leaky gut that we just talked about, to wash out the bug with the poop. And second, it activates the immune marker NF-kappa B. NF-kappa B is the desk sergeant at the police station. Okay, officers, you guys are going to this neighborhood today. You guys, you're going over here. Aisle 6, I want you over here. 2-minute necrosis factor, you're over here. NF-kappa B is the big boss that directs your immune system how to respond to a threat, okay? Like the desk sergeant at the police station. And the toll-like receptor, the sentry standing guard, it sees a threat in the food that's coming into the intestines. It activates all of that inflammation. So it does the zonulin to wash it out and also activate the inflammation to kill it, whatever it is. All of that happens within 5 minutes. Within 5 minutes.
So basically, to summarize, just if I understand it correctly, so when you eat something bad, whatever that might be, right? You gave the example of a bug or probably also gluten, right? I'm kind of hearing out. Then what happens is your body tries to flush it out of the tube as fast as possible. It kind of opens up the
space between the cells.
Exactly. So kind of this cheesecloth that you mentioned, right, is being opened up to bring in the fluids to wash it out, from what I understand. And this is where we are right now, right? And now the link that I would like to understand is, let's say this is how it works, which it probably is. Then what is now the link between this and the inflammation? So basically, because I'm kind of trying to understand the correlation, you know?
Perfect question, and that's right where we're going.
Okay.
The way toll-like receptor, the sentry, identifies the bug, it looks at the structure of the bug that it's seeing, the amino acid structure.
Mhm.
And, amino acids are many, like a brick wall. There's many different bricks in the brick wall. It's looking at the amino acid structure of bad bacteria, and it identifies the amino acid structure of bad bacteria. Here's the problem. And Fasano explained it really well in the article, All Disease Begins in the Leaky Gut. He said, gluten is misinterpreted as a harmful component of a microorganism. The sentry standing guard looks at the amino acid structure, and because no human can digest wheat completely into amino acids, no human can. That's one of the deficits. So it gets broken down into these clumps of amino acids called peptides. And there's many, 62 different clumps of these amino acids in wheat that have been identified to stimulate the immune system to make inflammation, right? So the sentry sees this food coming into the intestine that looks like a bug. And so it activates this whole inflammatory cascade immediately within 5 minutes. That's the kicker. That's the slam dunk. And when you understand that, you just look at the science. You can't argue with the science. And only 9% of the people get gut symptoms. The rest of them don't.
But basically, we're saying every time you eat gluten, it's kind of the same as eating a bad bug, like that shouldn't be in your system. Your system
A
fights
mild bad bug.
a mild one, yeah.
We think of explosive diarrhea.
Yeah.
Yeah, that's when it's really severe. But
Yeah.
a mild bad bug that creates increased inflammation, pulling on the chain, pulling on the chain, pulling on the chain.
So basically, an easy way to test this, right?
It's easy to test.
You just leave away the gluten for whatever weeks, right? And then test the inflammation then versus before.
Well, that would be helpful for most people, but it's difficult because gluten is hidden in your shampoo, in your cosmetics,
How is it?
in the vitamins.
Ah.
Yeah, people don't know, so the most accurate way is to do the right blood test. And when you do the right blood tests, they're very accurate and very sensitive now. Technology's improved dramatically. And you see, wow, look at this. My immune system is fighting wheat, but I feel fine when I eat wheat. But doctor, I've got Hashimoto's thyroid disease. Yeah. Well, it could be because wheat is creating the inflammation that's pulling on the chain that's manifesting at your thyroid or your skin for psoriasis or your depression or your anxiety.
And is this for everyone, or are there people that don't have these weak links and they might be just fine?
No human can digest wheat into its amino acids.
So it always happens through this work.
Every human.
Yeah.
Every time. Now, it's mild, so some people say, it's no big deal. I feel fine when I eat wheat. But they have this ongoing low-grade inflammation in their system. 14 of the 15 top causes of death are chronic inflammatory diseases. And so anytime you want to be healthier, the primary emphasis, anytime you want to be healthier, is to reduce the amount of inflammation your immune system is producing. And you don't do that by suppressing the immune system. Your immune system, Mrs. Patient, is the armed forces in your body. It's there to protect you. There's an Army, a Navy, an Air Force, a Marines. We call them IgA, IgG, IgE, cytokines. They're just different branches of the armed forces to protect you. So when they're called out, when your immune system is activated, the obvious question to ask is, what is my immune system trying to protect me from? Because it's the inflammation produced by the immune system that's pulling on the chain. And I don't care if you've got stage 3, stage 4 cancer. You have to reduce the inflammation if you're going to try to get better.
So am I reading this correctly? There's a couple of people who have much higher inflammation from this.
Go-
And these are, I'm just guessing now, these are called celiac patients, right?
Well, celiac is a disease that develops over time.
Okay.
Once you have the blood markers, the average is 7 years before you ever get celiac. Now, for some, it's quicker, but that's the average, right? And that's where we first understood that wheat is a problem for people, is with identifying celiac disease. But if you were to take the topic of identifying lead is a problem for people, the first thing you might identify, depending on where you looked first, might be osteoporosis, or it might be children's brain function. It just depends on where you look. And medicine looked first and discovered, which saved thousands and thousands of lives, that celiac disease was a end result of a problem with wheat. But by no means is it the most common manifestation of a problem with wheat. I mean, just Google lupus, the autoimmune disease lupus, and gluten. Here come the studies. Or rheumatoid arthritis and gluten. Here come the studies. So when you see that so many different diseases may be caused by pulling on the chain, and the weak link is the disease that you've got, but the pull on the chain may be caused by wheat. It may be. You just have to check to see. And it turns out to be a very common, important contributor to the inflammation that has eventually produced whatever symptoms a person has.
Mm-hmm. Okay, I think I start to grasp the concept. So basically, gluten equals inflammation. Inflammation equals, well, I never heard that it's good to have inflammation in your body, honestly. So obviously, it's a bad thing, right?
No, it's a great thing.
It's
It
a great
saves our
thing.
life every day.
Wow. Okay.
Yeah, because we're all exposed to threats.
Mhm.
You know, our ancestors were, because they lived outside,
Mhm.
they were exposed to bad bacteria and viruses all the time.
And it kills it.
And right.
Gotcha.
So the immune system saves our life, and you have an entirely new immune system every 4 months, right? So it's very, very important. But the excessive activation of the immune system, 14 of the 15 top causes of death, are chronic inflammatory diseases. It's the inflammation that's pulling on the chain that manifests at wherever your genetics and your antecedents are. And when you take the time to really dive into this and to see, well, that sounds like that would be very important if it's true. I mean, you don't have to believe me. You know, if you just take the time at 1 hour a week, allocate 1 hour a week for a couple of months to learn more about this topic, you become a zealot with all of your friends to say, this is incredible. It really is about inflammation and reducing inflammation. There's some common triggers to inflammation, like the toxins in water, gluten. There's no other food like wheat in terms of activating the immune system. Some people have problems with different foods, of course, but every person has an immune response to wheat, whether they know it or not.
And how are these studies designed? So my question is, on the one side, you kind of probably have studies that show gluten equals inflammation, right? On the other hand, you probably have studies way too much inflammation kind of triggers this, and that, which that really makes sense to me.
Yep.
And what's like, I don't know, top 3 studies you could cite that are most interesting for the viewer where they should start, looking into this, and maybe if you could summarize them in simple words. I know it's always hard, but I'm sure you do a great
It's
job.
a really good question. Professor Yehuda Schonfeld is considered the godfather of predictive autoimmunity. He runs the immunology department at Tel Aviv University. To give you a sense of this guy, when I interviewed him 2 years ago, at that time 26, there's probably more now, but 26 of the medical doctors who went back and got their PhD in immunology in his department There are many more than 26, but 26 of them chair departments of immunology in medical schools and hospitals around the world. They're his students. This gives you a sense of this guy and the influence he has in the world of immunology. They're his students. They're Schoenfeld students. He published a paper 2 years ago now, and like Fasano, Schoenfeld is a godfather, right? He published a paper, and I don't remember the exact title of the paper, but the beneficial effects of a gluten-free diet in different autoimmune diseases. And they showed that 63% of the time, people get better on a gluten-free diet, and this was confirmed in 79% of the studies. So not every study and not every person, but more than half the time, more than half, people got better on a gluten-free diet. And what did they notice? What diseases got better? There were 28 autoimmune diseases: rheumatoid, psoriasis, multiple sclerosis, Hashimoto's thyroid, Graves' disease, systemic sclerosis. The list goes on and on and on, where the Godfather says, when you look at all the science on this, more than half the time people get better, and 79% of the studies confirm it. Not every study, but the majority of them do. So what does that mean? How do you take that information? It validates that you just want to check. Just check. And if you're not happy with your health currently, just check. But check properly to see, do you have a problem with wheat? So let's talk about the testing.
Because this is interesting, because, for example, me, again, in the intro, I mentioned I feel perfectly fine, right?
Yes.
And yet I'm someone who really likes to, improve and get better, and I really try to measure, and I try to, the classic cycle: measure, kind of check, and then change and improve, and this is going forever, right? And this is a new topic for me, because, again, I love pizza, I love pasta, and I love all the things. And so far I haven't figured that, I don't feel bad, but I understand it. Only 9%, I think, or 7, 8, 9% actually have it that way. So specifically for really healthy people who are in the 91% who don't have any issues, how can I now go tomorrow to, where do I go? What do I do? What do I check? And why do these results matter, and how?
Really good question. I would wager 500 euros that you will come back and your immune system is fighting wheat. I would wager that, because you're a vegetarian, right? That means you're eating a lot of wheat. And there's no question. But you feel good because the rest of your lifestyle is really, and you look good, and your energy is good. But, it's just a wait and see. It might be 30 years before the pull on the chain weakens whatever your genetic weak link is. So how do you test for this? In 2008, I did 26 8-hour days around the country teaching about the dangers of gluten. 8 hours. Over 300 studies, and I would just show on the screen study after study after study after study. And all the doctors sat there with their jaw dropped. They'd never heard any of this at the time. Back then, the testing was very inaccurate. It missed many of the cases of the immune system fighting wheat, unfortunately, and there was no better testing available. When I'm on stage, I use my iPhone, and I'll say, if I had told you back in 1990, in about 30 years, 35 years or so, I'm going to have this little black thing in my hand the size of my wallet. There's no flips, switches on it or anything. I'm just going to run my finger across it. And I can tell you, and while I'm talking, I'm doing that, and I can tell you within 5 seconds that the air particulate matter today here is 18. It's a good day to exercise outside. But in Reno, Nevada, it's 38. Do not be on a bicycle outside. I can tell you anything you want. And what I did is I just turned on the app Air Matters, and it brings up the air particulate matter, any city in the world that you want to know, right? And I programmed it for a bunch of cities, a city that I'm speaking in, and then Chicago and San Francisco, a few others. If I had told you that in 1990, that I've got the encyclopedia of the world in my hand and I can tell you anything you want to know in 5 seconds, you would have thought I was watching too much Star Trek, right? There was no paradigm. There was no paradigm to even consider that possibility of what is common knowledge today. Science improves. The same thing has occurred in laboratory medicine. And what doctors don't realize is that the technology for most of the blood tests, most of the tests that are being done, is from 1990, 2000. It's 20, 30, 40 years old. They're okay tests, but they're wrong 2 or 3 out of 10 times. And you never know which ones are accurate and which ones are wrong.
I once had this. I tested some biomarker, it was about protein,
Mhm.
and it showed that I'm apparently incredibly protein deficient, like close to you're not going to make it, like kind of really bad. And then I retested, and 3 days later it was perfect.
Mhm.
And that really was like, wait, what?
Perfect.
So you should really test 2 or 3 times.
That's my point.
Yeah.
You don't have to do that anymore.
Yeah.
Mayo Clinic published in January of 2016, and they call it a new era in laboratory medicine. And the head author is a doctor who I have great respect for. I've been following him and reading his papers for 25 years in the world of celiac disease. His name's Dr. Joe Murray. Fabulous, fabulous educator. And he and his team refer to this laboratory medicine as a new era in laboratory medicine. And the accuracy of these tests is 97 to 100%. It's called sensitivity and specificity, but it's 97 to 99 and 98 to 100 every single time, right on the money. So now, as long as your immune system is functioning okay, if you have a depleted immune system or a suppressed immune system because you're taking steroids, you can't measure the immune system, right? It won't work. But for the vast majority of people, these tests are so accurate. They're called the wheat zoomer because you zoom in on the problem. And it looks at 26 different components of wheat, and is your immune system fighting them or not? And so you can do a simple pinprick, and it's extremely accurate. So now we can test accurately and easily for that.
And what's the biomarkers behind it? So if people want to go to the laboratory and test it, what should they test? Or do you just go to the laboratory and say, hey, I want to test the wheat
They don't
zoomer?
know that. No, they don't know. The wheat zoomer is a test from the laboratory patented the technology. It's called silicone chip technology. They're using silicone chips, and they can look at 6,000 different components in one blood draw. They don't, but they could. But that's the accuracy using silicone chips. When I went to visit, I read this paper, and I said, oh my God, this is what I've been waiting for, because I've been teaching about this and that the laboratory tests are inaccurate. I said, sorry, doc, so the best you can do is have them try it and, go gluten-free and see how they do. But now we have the tests, and the tests don't lie. And so it's called the wheat zoomer. You can go to my website, thedr.com, thedoctor.com. Just don't spell the word doctor out. Download the information on the test, take it to your doctor, and ask them to order the test. Usually they won't, because they don't know what it is, or they're stuck in the hospital system that only uses the tests that they're approved for. And if that's the case, you can order it on my website. But I'd rather the doctor orders it so that he then learns how to use this test. And I don't have any stock in this company, this lab. I wish I did, because they're growing, because doctors in the U.S. are going, oh my gosh, look at this. Wow, this is great. I finally have a tool that helps me identify my patients. And they have many tests, not just the wheat Zoomer, but that's the one that started it all. And it is so helpful. You can't argue with the results. And I did that. I argued. The laboratory tests I was using beforehand, sometimes they would come back negative, but I knew the patient had a problem with wheat. Well, the test is negative. Well, I knew it was a laboratory. So what did I do? I started doing 2 samples on people. I take 2 tubes of blood out of one blood draw. And the second sample I would label Joe Smith. And I'd send it to the lab with the patient's sample. And of course, I'd have to pay for that second one. You can't charge the patient or insurance. And 3 out of 10 times, the test results came back so different, you didn't know which one to talk to the patient about, like your experience. And that, for me, that was 3 out of 10 times. I've done that with the wheat Zoomer. Nothing. 2% variation, something like that, which is within the realm of error, 97 to 100%. So 2 to 3% difference, fine, I'll accept that.
And is there like inflammation biomarker?
You
Test before and after? Let's say
antibodies. The antibodies are inflammation markers. See, when you do, they also have an autoimmune Zoomer that looks at many, many different tissues. I think it's 12 to your brain and many other tissues in your body. Why do you have antibodies to your own tissue? When is that normal? How come if you do an antibody test for your thyroid, as an example, the lab gives you a reference range, usually up to 34 or 36, depending on the laboratory? Why is it normal to have 26 antibodies to your thyroid? Why should the immune system be attacking the thyroid? Because, Mrs. Patient, you have an entire new body every few years. Every cell in your body regenerates. Well, how does that happen? You have to get rid of the old and damaged cells to make room for new cells. That's called autophagy. That's the geek word, but it's getting rid of the old and damaged cells to make room for new cells. And antibodies are a part of that process. So they're normal to have antibodies to all of your tissue, to your brain, to your heart, to your lungs, your liver. There's a reference range that's normal. But when you have elevated antibodies, by definition, you're killing off more cells than you're making. That's the pull on the chain. And when the link breaks, now you've got the autoimmune disease because you've got the symptoms, you went to the doctor, and you got the diagnosis, right? So you do the autoimmune Zoomer, and you can tell, here's the weak links in your chain. And if you continue this lifestyle, pulling on the chain, this is likely where you're going to manifest it. And the science tells us it'll be within 14 years, or it'll be within 7 years. Whatever, I mean, they're beautiful tests, and they're very, very accurate.
Let's say I want to go on a scientific journey now and test today whatever biomarkers you're going to tell me, then go gluten for a specified amount of time, which you're going to tell me how long it should be, and then I'm going to measure the same thing again. Well, what's the biomarkers I'm going to test? How long am I going to do this? And what's the delta you expect?
We consistently see people drop their autoimmune antibodies and put their autoimmune disease into remission. That's the world of functional medicine. That's exactly what we do. But now we have the science to understand, and the tools, the tests, to accurately identify. And you don't retest for a minimum of 6 months. I prefer a year, but 6 months, because the lifespan of antibodies is anywhere from 2 to 4 months. So you don't want to retest while you still have the old antibodies there.
And you go completely gluten-free, or is there like threshold where you say, you can have, I don't know, I'm just saying 1 pizza a month or whatever. Like, is there an amount that is okay, or would you say
really good question?
Strict?
You can't be a little pregnant. You can't have a little gluten. Because when you do, now I'll explain this to you. I mean, it's a cute little phrase, but I'll explain to you why. When you get a vaccination, let's say to measles, they give you a shot of the bug, measles. And your immune system says, whoa, what's this? This is not good for me. I better fight this. And you have generals in your immune system, Army, Air Force, Marine Corps generals sitting around with nothing to do. General, you now are General Measles. General measles builds an assembly line. The assembly line starts producing special forces soldiers. They're called antibodies. And they're trained to look for measles in the bloodstream. And that's all they go after is measles. When they see measles, they fire their laser rifle and destroy the measles bug. Okay? Takes about 2 months, 3 months to build that assembly line. When General Measles sees that all the measles bugs are gone, okay, turn off the assembly line. You shouldn't have measles antibodies in your bloodstream right now, unless you've been exposed. But now you're on a plane and the guy in front of you coughs, and he was just in Africa and he was exposed to measles, and now there's measles bugs in the air. You inhale measles bugs, right? Now they're in your bloodstream. General Measles is vigilant the rest of his life. He sees that's a measles bug. He doesn't have to build the assembly line. He just has to flip the switch. And in one day, you've got measles antibodies to kill that bug before it's ever had a chance to get root in your body, right? That's the purpose of vaccinations. That's how they're supposed to work, right? The only food, now, General Measles is called a memory B cell. His job is, for the rest of his life, is just to be in the bloodstream, look for measles. If he ever sees measles, flip the switch. That's his only job. It's a memory B cell. Usually they're lifelong. Sometimes you need a booster shot, 20 years later or something, but that's how vaccinations are supposed to work. The only food that I can find evidence of memory B cells that are there forever is gluten. Not eggs, not dairy, not soy, nothing else, because gluten is misinterpreted as a harmful component of a bug. Do you remember?
Mm-hmm.
A harmful component of a microorganism. So now you've got the memory B cell. If that bug ever comes back, we're going to kill it, right? Right away. That's the only food. So no, you can't cheat. You can't be a little pregnant. You can't have a little gluten, because the memory B cell, the gluten is going to activate, and once it flips the switch, you've got antibodies for 2 to 3 months from one exposure.
And these antibodies cause inflammation.
Yeah. These are the antibodies to gluten.
Mm-hmm.
And if your weak link is your thyroid, now the thyroid antibodies come back again, or the lupus antibodies, or the multiple sclerosis antibodies. I did a docuseries called Betrayal, the Autoimmune Disease Solution They're Not Telling You. And we've had a couple million people watch it. And the first woman that we interviewed, she was with a walker. She was 36, I think, 38 years old, with MS.
Mm.
And her son got diagnosed with MS. And that made her completely change how she took care of herself. And so she found a functional medicine practitioner in London. He said, whatever he says, I'm going to do it. I'm not going to put my son in that, but we'll see the regular doctor, but I'll try all this stuff first, right? She completely reversed her MS, completely reversed it. And you see the interview with her, and she had 8 lesions in her brain, and she could hardly walk. 2 years later, she had 2 lesions left, really small, and no symptoms whatsoever.
Wait, so you're saying
you completely reverse autoimmune diseases?
Because that's kind of crazy, because I thought MS is like the really bad stuff,
Yeah.
right? The really, really bad stuff.
Yeah.
Usually they die.
Yeah. Well, it impacts the quality of their life, and they have a shorter lifespan. Yeah. Just watch Betrayal, and you see it. Now, I then did a docuseries last year called The Inflammation Equation, which is more focused on pulling on the chain. And I called this same woman, now this is 5 years later, to see what happened. Did you go back into MS? I mean, what happened to you? vibrant, dynamic, loves life, rock climbing, cycles, complete remission.
And are there studies on that? Because
Sure.
that's very, very interesting. So basically, kind of the hypothesis is if you have MS, leave away gluten and you're not gonna have it anymore. How does it work?
Remember Schoenfeld's article?
Uh-huh.
63% of the people get better, confirmed in 79% of the studies. Not everyone, not every time.
And this study was also about MS. That was included.
Yeah.
Okay.
Yeah, you see,
Amazing.
yeah.
Yeah.
So it's not every person every time. That's why the rule, this is the rule. In God we trust, all others require data. You do the tests, and now you have accurate tests. So you can breathe easy, everything's okay, or, oh, look, this is a problem. Okay, how am I going to fix it? Well, this will take 3-4 weeks, this will take 2 months, this will take 1.5 years, and you just outline, that's the functional medicine principle of long-term vitality. See, because here's the concept I tell every patient, I recommend to every doctor when I'm on stage that they talk to their patients like this. The average male lifespan is about 78, about. The average healthy lifespan is 62. That means the last 26 years of a man's life is with disease, some diagnosed and some medications. The average female lifespan is 83. Women live about 5 years longer, but the average healthy lifespan is 62. So that means the last 20 plus years of their life are with disabilities. Now, Mrs. Patient, I don't know if I can help you live longer. I really don't know. We'll find out when you die, how long you lived, right? But the difference between a healthy lifespan and total lifespan, I promise you, and I'm as sure as I can be, we can shorten that distance so that we elongate your healthy lifespan closer to your total lifespan. There's lots of good science on that. That's long-term health and longevity. That's what you look for. And the basic premise to begin with is, how do I reduce the pull on the chain? How do I reduce the inflammation that manifests at my weak link? That's the big picture concept. And if people had that concept, that's what the inflammation equation is about. I interviewed 64 world scientists on this, right? It's all free if you go to theinflammationequation.com. And if you understand that big picture concept, you start asking different questions about being healthy. You ask questions like you just asked. Okay, so if I go gluten-free, can I have a little once in a while? Well, that gets answered because of general gluten, memory B cells, and oh, okay, and here's the science on that, and so you start thinking differently. I want to extend my healthy lifespan. Maybe total lifespan, maybe not, I don't know. I mean, my goal is I want to shake it up at my son's wedding, so that people go, wow, look at that old guy go. Now, my son is 4, right? So I'm going to be, if he gets married at 28 or something, then I'm going to be 97, right? So, okay. So extending healthy lifespan, that's the goal. That's the goal.
And so you mentioned this test, right?
Yes.
Is there more tests, like more data one could collect?
Yes.
On this
Oh,
journey?
gosh, yeah. There's the gut zoomer, which is when people want to see me. I see about one patient every 2 weeks by Zoom, right? And I won't talk to them until they've done 4 tests. Because what for? I just hopefully my reputation will give credibility enough. Do the tests, and then we'll talk. It's the wheat zoomer, the gut zoomer, the total tox, TOX, total tox burden, and the neural zoomer plus. The neural zoomer plus looks at 53 markers of inflammation in your brain. Is my brain on fire? Because the number one disease that people are concerned about is Alzheimer's and dementia, right? Justifiably. I mentioned to you earlier, every child 14 and a half years old in Mexico City that they check, every single one has evidence of the markers of Alzheimer's because of the air pollution that's causing so much inflammation in their brain, right? So we all have inflammation in our brain. We just don't know it. And we start making jokes. Oh, I can't remember. Where's my keys? Oh, I'm getting old. I don't remember the way I used to. Well, how old are you? Well, I'm 34. No, that's not supposed to happen. That's pathology, right? So when you identify the inflammation in your brain, the NeuroZoomer Plus looks at 53 markers of inflammation in your brain with this kind of accuracy. And we say, whoa, wait, what? What? You identify that. That's what my book was about. My book's entitled, You Can Fix Your Brain. I argued with Rodale Press for 2 weeks on the title of the book. They wanted some other, no, this is the title. You Can Fix Your Brain, right? And it was #1 in 7 categories on Amazon for brain function. I mean, I'm very proud. It's a good book. And I talk about the tests in there. That this is the pandemic that no one's talking about, is how our young people, their brains are so on fire. That's why the 4th test is the total tox burden. It looks at 18 heavy metals, 28 mycotoxins from mold, and 38 chemicals like pesticides, insecticides, bisphenol A, glyphosate. As an example, glyphosate is a chemical used sprayed on foods. So most of the conventional foods now have glyphosate on it. In a French fertility center, they checked the men, and they found that men's glyphosate levels was 4 times higher. 75% of the men had glyphosate level in their blood that was outside an acceptable range. And if they had glyphosate level in the blood that was outside the acceptable range, it was 400% higher in their semen. The glyphosate accumulates in the semen. So you are a vegetarian. You're eating lots of fruits and vegetables. If they're not all organic, you're getting exposed to glyphosate every single day. And it accumulates in the hormone-loving tissue like the testicles and the ovaries. And in the testicles, it damages your sperm. Then, when you read about oxidative damage to the sperm, and you look at the result of the offspring of men who had oxidative damage to the sperm, the offspring have cognitive problems. Their brains don't develop properly in utero to whatever their genetic potential was because of the damage to the sperm causing, it's called fetal programming. And you see this with many other chemicals. That's why the total tox burden looks at 35 or 38 different chemicals. Because I just want to see what's going on in your body right now before we talk. I mean, your symptoms are important to help you feel better, but I need to find out where's it all coming from.
And can we go deeper on this test? So is this test, can I do it in any clinic?
It's a urine test.
Is it a specific company?
We send a kit. We send a kit to your house.
Okay.
You collect the urine, then you ship it to the lab.
Okay.
That's all.
Yeah.
With 97 to 99% sensitivity and specificity.
Basically, the test is like a collection of different markers that you really check. And
it checks for 18 heavy metals: lead, mercury, arsenic, cadmium, tungsten, nickel. 18 heavy metals, 38 mycotoxins, and 35, I think it is, chemicals.
Okay. But technically, people could also kind of extract these things and just say, hey, I want to know about, the 12 things inside that test. This is what's relevant for me. And then they could just also test that kind of on their own in a specific.
Are you asking if you can cherry pick what to test?
Yeah, I guess to me,
I don't think the lab does that. I think it's one test.
Okay, because to me, it sounds like the test is like, okay, you test this, and then you get a range of results, right? And I'm wondering, can I not just pick what do I want and then just go to any lab and just...
Oh, sure, you could.
You could. It would be the same, right?
Well, it won't be the same. Their sensitivity and specificity, their accuracy won't be as good, and it'll be tremendously more expensive.
Because what I'm trying to understand, it's not like a secret formula
No,
there. It's like
no.
more, here's the things we test, here's what you're going to get, and we have a good method to test it pretty much, right?
Exactly.
Okay.
The laboratory has done their due diligence. They've done their research to identify, well, what should we look for in this test? So they read all the science, they read much of the science as to what chemicals are most common in people and what heavy metals are most common and what about mold and the mycotoxins. And so they put that together. It's a incredible. So those are the 4 tests: wheat zoomer, gut zoomer, neural zoomer plus, and total tox burden. You do those 4 tests, and if you like, my suggestion to you is that you do those tests and you invite your followers to do the tests at the same time, and then I'll come back on and we'll interpret all the tests for you.
Now, that would be great, because I was about to say, if I have the data, it would be interesting if you can check it and if you could tell me, hey, this is going really well now. The delta is good because of this. And so, because I think it's pretty hard, for the average Joe to kind of look
Yeah.
at this and say, okay,
Oh, it's overwhelming.
absolutely.
It's really
That's why I was asking about the tests, because if it's like, I don't know, 46 biomarkers here, 73 here, like my brain is already shutting off.
Yes, yeah, I understand. You're absolutely right. And it takes a while for doctors to learn. That's why, sometimes I'm trying, like I leave next Wednesday. Where am I going? Where am I going next Wednesday? I'm going to where am I going? I don't know. I'm going somewhere. Oh, Niagara Falls. And I'm teaching doctors how to interpret the NeuroZoomer Plus. That's my talk. My 90-minute talk will be on how to interpret this. And because, there's 53 markers of inflammation in the brain that you're testing, and no one knows what to do with anti-tau antibodies. What do you do with that, right? So, yeah, it's overwhelming, and it takes a while, but it's so rewarding when you have the best science available and you get a big picture and it drops your jaw. I mean, you'll be surprised because you're living a very clean lifestyle, as a vegetarian, and you're conscious of your water and the air and things and all that. But you'll be surprised at what's accumulating in your body just living on the planet.
Yeah, I'm really curious, because I'm sure there's a lot of stuff, in the air, and of course, for example, in Zurich, my grandfather, used to live in Zurich. Maybe, I don't know, what is it, 60 years now. When he was 30, he's now 92,
Yeah.
right? Lives in Sardinia, one of the blue zones where
Yes.
they grow the oldest. And I remember he told me that when he went to Zurich in a white shirt, a day after he was walking around in Zurich, he saw visible stains of dirt, of bad stuff from the air in his shirt. That's the stories he used to tell me,
Yeah.
And of course, these days it's not like that, right? Luckily, but I'm still curious, how is that? And especially, I was, for example, in Pakistan once, and the air there, well, I can tell you, it's not as we are breathing it here in beautiful Piedmont, Italy, not at all.
Yes.
And I really wonder how, like, are there studies also there, like direct comparison, I don't know, in Pakistan or India, where the air is really not the best,
Mexico
objectively
City is the same.
also, right?
Yeah.
So there's data on that versus really clean air. For example, in Zurich, I think it's pretty good from what I know, right? I hope, at least, otherwise we might have to move, but that would be a pity. But yeah, it's really crazy, what's in the air. And I wonder if even in the clean cities, if it is a problem or if it is actually fine.
Well, and the water.
And the water.
Just the decades of the chemicals that have been exposed to, and the rain washes the chemicals down into the rivers, and that's where you get your drinking water. They clean it to some degree, but
They try.
yeah.
And what woke you up to all of this, right? Because, well, you have a medical background, and what you're telling me now,
1979.
I don't think you learned that in school, right? So you
No.
went on a journey to kind of figure all that out. Like, what was that journey like?
1979, I was an intern, and my ex-wife and I, we could not get pregnant. And I called the 7 most famous holistic doctors I'd ever heard of and said, what do you do for infertility? Well, do you know what a category 1 is? No. Learn. Okay, category 1. And I just made this list, and I put a program together. We were pregnant in 6 weeks. And my neighbors in married housing heard about that, and we lived on campus. They had been through artificial insemination, and nothing had worked. They asked if I'd work with them. And I said, well, I don't really know what I'm doing, but I don't think it'll hurt you. They were pregnant in 3 months. So now we're 4 months pregnant and just happy and telling the world. And I was in Chicago. I was in school in Chicago, and tell our friends, and my friend's sister in Wisconsin had 2 miscarriages. Could she come see you, please? Please, could she come talk to you? So, well, I'm not licensed yet. I'm not, but I started treating people out of my dorm room and talking to them. And we opened our practice on Valentine's Day in 1980. And we had 33 new patients our first day, and nothing was free or anything, but so I was dealing with infertility and reproductive system disorders the day I opened my practice. So there's not much in medicine that's all or every. This was every couple that I saw with any type of hormone-related problems, infertility, premature ejaculations, recurrent miscarriages, every single one of them as a contributor to the inflammation they had. They were eating foods that they did not know were a problem for them. Every one of them. So that's what got me into this whole world of holistic healthcare, was the package I put together for my wife and I to get pregnant. And I have 2 beautiful children from that marriage. Um, and I started learning more and more and more. And Dr. Jeffrey Bland, my friend Jeffrey Bland, the founder of functional medicine, I heard his first talk in Chicago in 1978. And what he did was he would show a study and say, this doctor in the New England Journal of Medicine showed this 9 years ago. And this doctor in the Journal of the American Medical Association showed this 5 years ago. And here's an article from the British Medical Journal just last week. Do you see how they're connected? And he would teach us how to see the bigger picture of where inflammation comes from and where disease comes from. That's what functional medicine is. Not just getting people feeling better with their presenting complaints, but to understand. See, my belief is you need a map. I show patients this. I'm from Chicago originally, and it's a easy town to get around. And especially if you have a map, it's really easy to get around. You get anywhere you want without any problems. But the map of Chicago does you absolutely no good in San Francisco. Your friend may have Hashimoto's thyroid disease, and they did this and this, and it really helped them. You've got Hashimoto's thyroid. Not going to work if you do what they did. You need your own map.
Mhm.
You need to identify the map to the highway to better health. And what does that mean? You have to find out what the history is. Is it too much lead? Is it mold toxicity? What are the triggers pulling on the chain that are manifesting in the weak link? Whatever it is. That's why it's individualized for every person.
So basically, do the tests, see what is good, what is bad, go from there.
Exactly.
Yeah.
Exactly.
Yeah.
In God we trust. All others require data.
So basically, really out of your own necessity, right? From not being able to produce kids, right? To put it blankly.
That's exactly right.
And that's where he started this whole journey, yeah.
And we have people like our videographer for today's event says, I'm not giving up gluten. I love my pasta, right? But I mean, if he and his, if he's married, he and his spouse want to have kids and they can't have kids, then when you start looking, you say, well, look at this. You're off the charts on your immune system fighting wheat. That's excessive amounts of inflammation. Then you just Google infertility and gluten, and you see there's all these studies, and you go, wow, okay, I'll give this a shot because now it's really important. Unfortunately, for most humans, they have to be sick enough in order to be motivated to change the lifestyle that actually is producing the problem.
Yeah, I mean, the whole medical system is built on this premise, get sick and we'll help you. We'll make a lot of money alongside it as well, you know?
That's exactly right. Unfortunately, the most profitable person for a pharmaceutical industry is a sick child,
Yeah, fortunately.
that they'll have them for years and years buying their medications.
Yeah. Yeah, and it makes the system just costly for everyone, you
Yeah.
know? If if most people would even just do the basics, you know? I mean, now we're already speaking about, well, how could I, for example, get the last 5% or whatever the percent would be, right? But there's a lot of, I don't know, smokers, junk food eaters out there, and well,
How many of your
it's not gonna
friends
help
and the
you.
people you meet are on antidepressants?
A lot,
Exactly.
and a lot more than maybe 5, 10 years ago.
Exactly.
Yeah,
It's getting worse. It's
yeah,
pandemic getting worse on the brain.
yeah.
What I said earlier about every child in Mexico City, has evidence of Alzheimer's. Every single one of them is wait, what? 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 I mean, it's hard to imagine this, but more and more people, and that's why I do the NeuroZoomer Plus on every patient, is because your brain weighs about 2% of your body weight.
Mhm.
Okay. But it has 16 to 18% of the body blood at any one time. So if the blood is the carrier for the inflammatory molecules and they're sitting pooled in the brain, where are you going to see the symptoms first?
Yeah.
That's why you do the NeuroZoomer Plus.
Mhm.
And it scares the hell out of people. And say, okay, this is not good, but this will take 2 months. But this one will take 6 months. This one's a year and a half, but you just stay on it and then we'll recheck. And if you had 18 markers out of 53 that were elevated to begin with,
Mhm.
and we recheck in 6 months and you've got 9, so it's not working. No, it's working really well. You're 50% better. You're on the right track. Keep it up.
But could it be that I'm gonna do this test and you're gonna tell me, look, you have, I don't know, 3 out of 18 markers are bad and the rest is good?
Yeah.
And could it be that for me personally, because again, health is incredibly individual, right? As you mentioned numerous times already, and I fully agree with that. Could it be that I might be just fine? Or do you kind of categorically say you're probably not going to be fine given the knowledge I have, given the experience I've gathered with all the patients I've seen?
That's a really good question. If you have 3 markers elevated in the NeuroZoomer Plus, and but then your total tox burden is elevated, you've got 7 chemicals or whatever it should be. It's a well, I'm from Chicago. It's a crapshoot. Will you have symptoms in your life based on the amount of brain? Elevated antibodies means you're killing off brain tissue, killing off brain tissue, killing off brain tissue, without exception. That's what the definition of elevation means. You're killing off more cells than you're making. So, well, am I going to have symptoms with that? I wouldn't want to find out.
Mhm. But of course, also it's a scale, right? You can obviously say if a patient has 17 out of 18, he's much more likely to, well,
Oh, yeah, of
gonna
course.
get bad than if I have
You
3 out
bet.
of, yeah,
You bet.
yeah.
Mhm.
So then I guess it's always a trade-off, like, because I'm always a fan, measure 100%, like do it because it's better to know, if, well, knocking on wood, right? But if you have cancer, it's better to know, especially early, or if you have anything bad, it's better to know. It's my opinion, but I really think it's true. So also here, I mean, I'm incredibly open-minded. I'm really, we're gonna check it out together.
Yeah.
We can see. I'm happy to do this test for science. Then we can sit back again and
Yeah, invite
evaluate.
invite your followers to do this with you,
Yes,
and then we'll do a session and we'll interpret the test
Yeah.
results.
yes,
Mhm.
absolutely. Now the word autoimmunity was now said numerous times by you. Could you please quickly define this term? Because honestly, I can kind of imagine what you mean, but I would love to have like an explain it like I'm five definition, if you can.
There's a few different types of immune function. One of the functions is your body gets rid of old and damaged cells to make room for new cells. The technical term for that is autophagy. And you want to increase autophagy, clear out the debris, the cells that aren't working so well. And the better the autophagy, the younger the person's body. right? And the antibodies to yourself, antibodies to self is what autoimmune is. The antibodies to self are part of the autophagy process. Normal to have a certain level. But when you have elevated levels, now you're killing off more cells than you're making. Now you're on the autoimmune spectrum to develop an autoimmune disease.
And this can be tested, right?
Yeah, that's the autoimmune zoomer.
Exactly it, yeah.
And that's what my docuseries, Betrayal, the autoimmune disease solution they're not telling you, was all about.
Okay, so basically it means I'm killing more cells than my body is capable of replacing,
Correct.
which means I'm going to run into troubles, perhaps.
Correct. And
Yeah.
we now know how many years before you run into trouble.
Mm-hmm.
We now know for most of the autoimmune diseases.
And is there like early warning signs, for, because I guess it's many different things, right? So this could develop into probably, I don't know, 20, 30 things. Is there like early warning signs people would see, or?
Well, depending on which antibodies are elevated,
Mhm.
will determine which tissue is being damaged.
Yeah.
So this is a study that I recommend every doctor read because it's foundational to understanding autoimmunity. New England Journal of Medicine in 2003. Melissa Arbuckle, Dr. Arbuckle, who's a student of Schoenfeld's, right? She worked at the VA, the Veterans Administration Hospital, and she looked for people in her hospital with lupus, the autoimmune disease, systemic lupus erythematosus. She found 136 people in her center diagnosed with lupus. Now, if they're in a VA center, they're veterans. If they're veterans, they were in the armed forces. When they were in the armed forces, they had their blood drawn many times over the years. When they were healthy in the Navy and in the Army and the Air Force, many, many times. And what most people don't know is that the government's been saving and freezing almost all of that blood since 1978. They've got tens of millions of samples of our service people's blood. Well, Dr. Arbuckle knew this, and she asked for permission to look at the stored blood of the currently diagnosed lupus patients when they were healthy in the Navy or the Air Force. She got permission, and what did she find? Every single person, there are 7 antibodies to lupus. Every single person had all 7 antibodies elevated above the normal range 5 years before they ever had a symptom. 5 years. Some of them 9 years, 11 years, 13 years, but all of them 5 years before they ever had a symptom. And every year the level went up and up and up. And it hit this plateau piece. Now they get symptoms. And then 6 months to a year later, they get the disease. So she did a graph in her article. She said, first you have normal immunity. You have a normal reference range of the antibodies, getting rid of the old and damaged cells, making room for new cells. Then you have what she called benign autoimmunity. It's not benign. It's killing off tissue, but there's just no symptoms. Then you have pathogenic autoimmunity. Now you have symptoms. And then you get the critical illness. You get the diagnosis. When did they get lupus? Back here, when the antibodies were elevated. Something pulling on the chain and the weak link was breaking, and now for them, lupus antibodies were going up. For somebody else, it's celiac antibodies are going up. For somebody else, it's Hashimoto's antibodies are going up. For somebody else, it's multiple sclerosis. But it's years before they ever have a symptom. That is the world of predictive autoimmunity. Once again, Melissa Arbuckle is a student of Schoenfeld's. Schoenfeld's the godfather of predictive autoimmunity.
And gluten kind of reduces that risk, right? From what I understand. Is there other mechanisms as well?
No. Gluten-free reduces.
Exactly. Yeah, of course. Absolutely. No, gluten-free. Absolutely. That's of course what I meant. But I'm wondering, is this the only fix, or are there other fixes as well? Or is it like a holistic do these 10 things. Gluten is the third, that is very important, or non-gluten, of course. But what is like the range of things people should?
Yeah. In God we trust. All others require data.
Mm.
For somebody, it's mold. You've got to find the source of mold. And for somebody else, it's dairy. For somebody else, it's lead
But
toxicity.
you see that in the data.
Yeah.
You do.
Yeah. If you do the right tests,
Got it.
you're looking for the triggers of inflammation.
Yeah. Interesting. Yeah, I think this is an important component because
Exactly.
from what I understand, or honestly, how I read you online, we met the first time today, right? I really saw you as this gluten-free kind of person. This is like it seemed online, not the only, but like the main thing you're focusing on, right? But it sounds like basically you're saying there's an underlying mechanism that is causing the things. Non-gluten or gluten is causing or not causing it, right? But there's a range of other things, and we really
Oh my
need to look
goodness,
at
yes.
that, right?
Yeah. Well, I
That's
appreciate
important.
you making that comment, because you're a younger guy, and so the representation that my website is doing is still too much about just one thing, which is gluten. So we'll rewrite the website this year and get this bigger picture up there, because it really, I do think that this is my flagship message to the world, is this concept that 14 of the 15 top causes of death are chronic inflammatory diseases. And if we focus on reducing our inflammation, finding out what the triggers are of inflammation for us, then we extend healthy lifespan closer to our total lifespan. That's the goal.
Makes sense. And probably, I'm just thinking out loud, you could even kind of put yourself in an LLM, like in an AI, where people can just do the tests and kind of we can feed it with enough data that you can say, hey, you should do this, this, and that. This actually might be interesting, that I will not replace you, but we could try to augment you, for that even more people can use it.
Yeah, yeah. Getting the message out is the most important thing.
Because it sounds like it's all patterns, you do tests, you see patterns, you tell the patient, do this. And honestly, an AI is incredible at this, and the more data we feed it, the better it would do, and yeah, that might be some food for thought. I don't know. But no, I mean,
As you wrestle with this interview,
Mhm.
I'm suspecting and hoping it becomes a primary line of thinking for you
Mhm.
in talking about health. And everyone that you interview in the future will come from this background in you of how are you contributing to reducing the inflammation in people?
Because I never thought about this up
my
until
point.
today, really. And I'm a health freak. I would really put it that way. I do my blood work every 6 months. I do full body MRIs. I do many other things as well. I really try hard to live a good and healthy life because it makes me feel good.
Yes.
And it's funny that
I'm smiling,
it never crossed my desk, this concept.
I'm smiling because we're going to drop your jaw.
Yeah.
We're going to really drop your jaw. It's going to be an OMG. And
Okay.
oh my God.
Yeah.
Oh my God.
Yeah.
Yeah. Yeah. Which is marvelous because you are a messenger, right? I'm a prophet.
Mm.
I'm just bringing out information, but you are a very effective messenger to carry that information out in the world. And I'm very grateful that we're here today.
Yeah, and I'm a guinea pig. I'm open. I mean, I know if I try this, it's obviously not going to kill me. If anything, it's going to help me. So might as well do it.
Yeah.
And perhaps we sit back together in 6 months, and I'll tell you, it worked wonders. Perhaps it will be the exact opposite. We don't know, but I am open-minded to go on this journey. And as you said,
It's marvelous.
don't guess, right?
That's right.
Yeah, the truth is in the data.
Yeah.
So yeah, what do you think now with AI, with all these advances? Like everything seems to go super fast. Everything is progressing incredibly fast, and that was in front of the camera, my friend. That's okay.
Yeah.
Yeah.
Do you want to sit with me for a couple of minutes?
Yeah. Come here. Come. Let's do the last part with you.
Yeah. Okay, let me go right here like this.
So for my final question, we have a little special guest.
Yes.
Exhibit A, that the methods work, right? Hearing the background, it's living proof that it actually works. Now, how do you see this whole thing developing? Because now with AI, obviously it's tremendous, right? The progress we are making everywhere. Like, I am a firm believer I am hopefully going to live 120, 130, maybe even longer. Not because I'm fantastic, but just because the science is gonna get incredible, you know? And I wonder, how do you see your specific field kind of grow in the next 10 years? Because even if you look 5 years right back, the world was a different one than it is
Yes, yes,
today.
it was.
Like, how does this apply to your specific niche?
That's a really good question. And it's an area that I have very little experience in. I know very little about AI. And I'm looking forward to learning from you about this and how to use AI to really package this information in a way that more clinicians can understand and then guide their patients.
Mm.
I really want this to trickle down to hundreds of thousands of people very quickly.
Mhm.
Because in my world, it's difficult to argue with this. This is, I call it basic 101 information. You know, you go to university and the first class you take for English is 101. Then you take 102. Then you take 103. Then you go the second year, 201, and like that. This is 101. Every doctor should have learned this at 101. Reducing inflammation, and that's pulling on the chain, that's in the weak links by genetics and antecedents. Everyone should learn this. And that's what they're teaching now at Harvard Medical School. Fasano is including this in the curriculum for all of our new doctors that are coming out, which is marvelous, you know, that they're thinking a bigger picture with all of the fabulous science and improvements in surgeries and pharmacology that they also are being trained in. But hopefully they're going to keep a big picture.
I hope so too. And honestly, my main business is medical AI, right? I run a medical AI company, and I really see the new generation of doctors who are our clients. They're incredible. Like, they understand this paradigm shift, which is, we don't have to cure people. We have to, well, prevent them from getting sick. And
Yes.
this, if I, well, quite frankly, if I speak to, I don't know, a 65-year-old doctor, which is my client, versus a 35-year-old doctor who maybe just graduated,
Yes.
it's going to be a very different worldview.
Yes.
And to your question, how can you integrate AI into this? You'd be surprised how good of a doctor ChatGPT is, as silly as that sounds, I do all of my blood work analysis with ChatGPT
Ah,
and learning a lot, like, what does that mean? Like, how does this work? Why does
yes.
this matter? How is it connected? What do I need to tweak? It's like my mentor, where there's no stupid questions. Every question is
Yes.
allowed.
Yes.
And I mean, I'm probably an idiot, compared the knowledge I know versus what you have in your brain, right, for this specific topic. But with ChatGPT, I can unlock a lot of the things and you take for granted. And for me, it's like, oh wow, that's
Right. So
interesting.
with ChatGPT, you can download my books, you know, and download a couple of my presentations that are on YouTube or something. And then now it's got all that background information. And
Put it in there, and
Mhm.
probably all of your raw information, book-wise, plus your test data. And I'm pretty sure I'll test it, but I'm pretty sure ChatGPT will be able to give me a very similar answer, 9 out of 10, what you would be telling me.
That's very interesting.
Yeah.
I look forward to seeing that.
Yeah. Now, final question. What's one thing the listeners can change today? Let's say they don't want to go through the hassle of testing and so on and whatever. What's like one common sense thing you would tell them, hey, if you do one thing, do that?
Increase hydration levels.
Hmm.
For humans, it's 1/3 of an ounce per pound body weight. If you're doing saunas or exercising aggressively, so you're sweating a lot, it goes up to a half pound or a half ounce per pound body weight. And you need to include minerals to replace the minerals if you're sweating a lot. Uh, we're a dehydrated society. First thing in the morning, most people, when they wake up, they go to the bathroom. Very next thing, drink 12 ounces of water right away, right away. And most people find within a few days of doing that they have better bowel movements within an hour than they've had in a long time. It's startling for people. But just making sure that you're well hydrated. Because if you back your car into a snowbank and the exhaust pipe's in the snow, the exhaust comes into the car. When you're not eliminating well, you get more toxic. And one of the keys in our society today is to reduce the toxic accumulation in the body.
Well, learned a lot today. Thank you so much for this. Really, truly appreciated you having us here in your wonderful home in beautiful Italy.
Well, thank you. It's a
And,
real privilege.
I'm already excited to check back with you. Really, once
Marvelous.
we've gone through the tests and once I was able to be your guinea pig, and to report back to the world how that journey went. So thank you so much.
You're
Appreciate
welcome.
it.
Thank you.
Thank you.